Givers is stepping up and stepping out on World TB Day to show their support for communities like Cluttersville in Stellenbosch, where the prevalence of TB is very, very high, higher than the WHO standard, in fact, which is around 700 to 800 cases per 100,000 people. Here in this area, it's over 1,200 patients per 100,000 people. So the prevalence here is very high, almost double of what is recommended by the WHO. But of course, Gift of the Givers here, as I said, to assist the work that is being done here by the provincial government, by the national government, to throw their all at the TB epidemic, because it's still very much a crisis in 2025. Let's speak now to Gift of the Givers founder, Dr. Imtiaz Suleiman, about their program. Dr. Suleiman, always a pleasure. Why are you here? What is the assistance you're giving?
We got contacted by the National Department of Health. They said, can we get involved in their campaign End TB, where you highlight early detection, early testing, start early treatment, maintain treatment, finish treatment. That was the slogan of the campaign. But it's not something new to us. We do this every year. And this year we decided to use Stellenbosch, as the area, because there's a university here, there's a medical school, there's a research facility, and also we know the people from this clinic. We've been here before, Arnhem Park Clinic. It is not so much only about helping and identifying TB or promoting TB. We came to encourage the sisters. Sister Fortain and the team do incredible work. Sometimes I think healthcare workers don't get enough acknowledgement in the most difficult of circumstances in the country and for the work that they do. So we said, let's encourage them. You mentioned earlier, in the area in the winelands, the incidence of TB is high. And farm workers, they get tested, but they don't come back to carry on with the medication and don't follow up. The other thing that was worrying, that in Cluttersville itself as an area, the incidence of TB is rising. But more frighteningly, it's among children that it's growing. So we said, okay, let's support the initiative. And there's a lot of hungry people here. There's a lot of poverty and unemployment. You can't take the medication if you don't have food. So we said, intervene with 150 food parcels for 150 families. But doing it one-off is illogical. So I said, let's do it for a whole year. So by doing it for a year, we can add a research element also. Then we can do research if people with TB medication have food parcels and they eat, how more compliant can they be and how more effectively can we treat the disease. And that's what we're going to do for the next year, to research to see how efficient we are. And of course, you saw young people coming here from the university. It's such a good feeling to see there's such an enthusiasm among healthcare professionals and even the patients who are coming here willing to get treatment, and they are a model for the rest of the country.
We've heard from healthcare workers on the ground, like you said, like Sister Keet that we spoke to, Valencia Keet, earlier. The PEPFAR funding assisted in contact tracing and things like that. But you said not to despair because there is no more funding from America, but society as a whole must come together.
Yes, I hate the idea that we regard it as the begging bowl continent. When I take my disaster teams all over the world, it's insulting. Are you from Africa? Oh, what did you come to fetch? What did you bring with your begging bowl? I'm telling them, get lost. You know what? We're not interested in you. We have the resources, we have the skill, we got the Ubuntu spirit, and corporates, to their credit, are coming more and more to the party. And health has become a number one priority since the time of COVID. It wasn't number one. It has become number one. And we actively, we don't look for money. But the corporates approach us. We're actively putting health in the space. Tonight I'm talking to a big foundation in Hermanus, to the entire board, members from the country and outside, and we're going to put health right on the top again. That's what we do. But yes, as ordinary people, as government, as multinationals, let's fund this ourselves. So medical companies make the things cheaper, make it more affordable. Let's get medicines, quality medicines at a cheaper price. Let's do it ourselves. Government reprioritizes funding. Make sure money is used prudently. It's not wasted. It doesn't go into corruption. It doesn't go where it's not needed. Prioritize, and let's put it where we can do and deal with conditions like TB ourselves.
And lastly, just give us, as a medical doctor yourself, you would know, how prevalent and serious is TB in our country still?
It's still very high. That's why the campaign. As I said, in 2023, there were 56,000 deaths. That's 153 deaths a day of a preventable disease and a curable disease. It's not something that's not preventable and curable. That's heartbreaking. That's what we know. What about the ones that we don't know? Yeah. And that's why I like to thank the health department. I like to acknowledge this campaign that they've got, and kudos to them that you've come up with a strong campaign. Let's go all out. They want to use influencers, they will use high-profile people, they will use people to get the message across to the country. In return country, please go and get tested. They want to pick up 250,000 undetected cases, which will make a huge difference for treatment of TB in South Africa.
Thank you very much, Dr. Imtiaz Suleiman there from Gift of the Giving Givers, telling us let's take hands as society, as government, as the private sector to help fund those gaps that exist now, and that is a problem. We heard from Sister Valencia Kiet a little bit earlier saying that the PEPFAR funding assisted especially in contact tracing, which brought them to more cases where people had TB, and Dr. Suleiman saying that if people take hands, everyone who contributes in any way can help to make a difference and to help to fill those gaps and make health a top priority, but also tackle TB, which, as you heard him say, preventable and curable. If more people come forward to get tested, get their treatment, then fewer people have to die, and that is the message here today.